All right. Good morning, everyone. Welcome to the Lower Cost, Better Care bus tour. As you can tell, I am not standing in front of a bus. Unfortunately, the weather here today has pushed us inside, but we're still so excited to be here. My name is Ann Schaup with Protect Our Care, and we're here this morning in Scranton, Pennsylvania with an amazing lineup. Excited to be traveling in my home state of Pennsylvania. So we did the math for this bus tour, and we are traveling nearly 12,000 miles. We're going to be having events in over 20 states. And Protect Our Care's Care Force One bus is crisscrossing the nation with one message. Thanks to President Biden and Democrats in Congress, help is on the way. I am so honored to be here today with some real healthcare champions. We have Senator Bob Casey, Congressman Matt Cartwright, and some of our amazing healthcare advocates that have been working tirelessly on this issue. We're here to talk about the Inflation Reduction Act's game-changing measures to lower healthcare costs for seniors and families across the Commonwealth of Pennsylvania. As soon as next year, millions of Americans will save big on their healthcare costs. Between saving seniors thousands of dollars on their prescription drugs and lowering monthly premium costs for working families, this bill stands to help millions afford life-saving treatments and reduce harmful inequities in healthcare. The Inflation Reduction Act is historic. With this bill, lawmakers have finally delivered on their promises. They are standing up to Big Pharma and other special interests to put real people first. This bill ends a 20-year ban on Medicare negotiations, which has only kept prices high for patients while lining the pockets of drug companies, executives, and their shareholders. This bill also caps out-of-pocket costs for seniors at $2,000 a year, limits insulin costs to $35 a month, and stops many of Big Pharma's egregious price hikes. Just last week, the first healthcare provision in the Inflation Reduction Act took effect. Drug companies will now be charged a penalty when they raise drug prices faster than the rate of inflation. The Department of Health and Human Services found that drug companies hiked prices at the rate of inflation on more than 1,200 medications. In addition to the game-changing drug provisions, the Inflation Reduction Act also lowers premium costs for 13 million Americans who purchase coverage on the Affordable Care Act marketplaces. The Inflation Reduction Act was desperately needed. I don't need to tell you all that. For many, this bill will lower the cost of health care by thousands of dollars a year, giving them breathing room to pay for other necessities like food, gas, and rent. This is a victory, and it should not be understated. The Inflation Reduction Act was also overwhelmingly popular. People wanted this bill. Poll after poll shows that people from all walks of life support the bill's healthcare measures. However, the Inflation Reduction Act passed without a single Republican vote. Let's be clear. Not only did Republicans in Congress vote to keep healthcare costs high, but they're already fighting to repeal the Inflation Reduction Act entirely. We cannot let that happen. So I'm excited to bring up our first speaker today, Laura Packard, who is a stage 4 cancer survivor and healthcare advocate. I don't think anyone has spent more time fighting to protect the Affordable Care Act, and now she is going around with us on this bus tour to talk about the Inflation Reduction Act and how it will help people across our country. Laura?
Good morning, Scranton. My name is Laura Packard, and the Affordable Care Act saved my life. About 5 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. I was lucky because I had insurance through the Affordable Care Act. So I was able to go through 6 months of chemotherapy and a month of radiation to be here today in remission. But too many people have not been able to afford the health care that they need. When I was diagnosed, there were limits to how much help you could have to get an insurance policy through the exchange. But thanks to Democrats in Congress with the American Rescue Plan and now the Inflation Reduction Act, your health insurance premiums are capped at no more than 8.5% of your income, which means millions of Americans can finally get the health care that they need. But that's not all. Also in the Inflation Reduction Act are the things that Ann talked about. Lowering the cost of prescription drugs by finally allowing Medicare to negotiate lower prices for our seniors. Capping their medication out-of-pocket costs at $2,000 a month. And a whole bunch of preventative services will be included in Medicare too. My dad is already asking me when he can get his free shingles shot. So I'm looking forward to the opportunity to build on these bills because we've started, we've made progress, we've defeated Big Pharma once, but we need the right people in Washington, D.C. to carry on the progress and keep going until everyone in America can get the health care they need and deserve. Thank you.
Thank you, Laura. It is now my honor to bring up Senator Bob Casey, who we have worked with very closely, has been just a partner on this issue. He's always there fighting alongside of us and uses his positions on committees on the Finance and Health and the chair of the Select Committee on Aging to really fight for people so that they have access to better health care for seniors, for people across the state of Pennsylvania. So thank you for your work, Senator Casey, and thanks for being here today.
Well, Ann, thanks so much for your leadership and for being here and for bringing that great bus to Scranton. I haven't been inside it yet, but it displays that message that we need to be conveying all across this region, all across our Commonwealth and across our country about lower costs and better care. Help is on the way. It's so important that we tell that story because there are a lot of people that are just beginning to learn about the details of even the overall provisions of the Inflation Reduction Act. And a lot of it, despite its name, a lot of that bill, of course, is about lowering costs, healthcare costs for seniors and for families. So, Ann, I want to thank you for your leadership. I'm honored to be with United States Representative Matt Cartwright, who is not only a great member of Congress, but he's my representative. So whenever you can hang out with your member of Congress and be able to talk about such important issues, I'm just grateful he's here, and I especially appreciate his deep and abiding commitment, not just to public service, but fighting on behalf of those who would not have a voice in many instances without his leadership. So Matt, we're grateful you're with us. We want to make sure that Matt Cartwright continues his fight for better health care and lower costs. And we're going to be helping him do that. There's a special event coming up in early November that we're all aware of. Robin Stelly, I want to thank you for your leadership at FAN. So many instances when FAN has been helping us get the message out about health care and especially the Affordable Care Act. And to Laura Packard, I want to thank Laura for making the journey here, for being on this bus to convey this message. And Laura, I want you to know that your story, your inspiring story, and your uncommon courage lifts our spirits. And we're grateful you're willing to tell your own story. That is the only way that we win these battles. Legislation is important, details are important, but it's critically important to be able to have people tell their own stories. Here was the state of play, in my judgment, before we passed the bill in August. And you could say this wasn't just true then, it was true for years, even decades. And I'll just personalize it to Pennsylvania. Older Pennsylvanians draining their savings to pay for life-saving medications, excuse me, life-saving prescription drugs. That's the reality of so many seniors across our state and across the country. While they were draining their savings to pay for those prescription drugs, Republican politicians in Washington were refusing over and over again, year after year, decade after decade, refusing to act. And at the same time, and the second is related to the third, powerful corporations spending millions to block this bill or any bill that would lower the cost of prescription drugs. Guess what? Democrats acted to lower the cost of prescription drugs. We defeated the most powerful special interests in our country, who spent not just millions in the last couple of months and years, tens and tens of millions of dollars. And when you add up the lobbying costs, it gets into billions of dollars to stop us from lowering prescription drugs, the cost of prescription drugs. But guess what? They lost, and the people won. Seniors won when we passed this bill. So we lowered the cost of prescription drugs for seniors on Medicare Part D. We acted also to lower health care premiums in 2023 for, in the case of Pennsylvania, approximately 346,000 Pennsylvanians. And third, we acted to lower insulin copays to $35 a month for seniors, and that will start as well in 2023. That will directly impact, right now we know, at least 87,000 Pennsylvanians. We tried to lower those insulin costs and keep the copays at $35 a month for every American that needs insulin. But guess who stopped us? The Republicans. So we have more work to do on insulin, more work to do to lower the cost of prescription drugs. We know that the negotiations will start over the next couple of years, but there's more work to do to lower health care costs and to give people the peace of mind to know that their government, the federal government, is going to stand up for seniors, stand up for families, to get costs down and to provide better care. God bless the work of Protect Our Care, and I want to thank everyone for being here today.
Thank you, Senator Casey. Thanks for fighting for this, and we look forward to continuing the fight with you. I now want to bring up another amazing person who is representing Pennsylvania in D.C. and will, I'm sure, be continuing to fight for these issues. He has definitely used his time in Congress to advocate for working families, to protect seniors, and of course to ensure that every person in the Commonwealth of Pennsylvania has access to quality, affordable health care. Congressman Matt Cartwright.
Thank you, Ann, and thank you to all of you who arrived by bus today. This is an important stop, northeastern Pennsylvania, because we have a lot of people who are hurting from the inflation, and that's one of the things that the Inflation Reduction Act is about, is reducing some of the most biting increases in costs that people have had to sustain over the years. Healthcare costs and costs for medicine. It's something that Democrats have been working on. You know that I am very bipartisan. I work with Republicans all the time. But one thing that has me very disappointed in the way the Republicans down in Washington have behaved is that they're all about the power. They're all about the politics. What Senator Casey just went through and what I've been working on, it proves that we're about the people. We're about helping the people, the ordinary, regular people in the United States, and certainly here in northeastern Pennsylvania. This is a story about people over politics. The Democrats are for the people. The other side, they're about the politics and getting their hands on the levers of power all the time. When I talk about sticking up for the people, I think about lowering costs, lowering prices, fighting this inflation in significant ways. I think about building safer communities because the top priority of any public official has to be the safety of the community, and we do that. And certainly also what we're working on in the Congress is more jobs, more and better paying jobs. So it's about more jobs, lower prices, and safer communities on our side of the ledger. On the other side, what are they up to? Senator Casey's colleague from Florida, Senator Rick Scott, came out and said the quiet part out loud. not too long ago. He wants to sunset Medicare and Social Security every 5 years. So, in other words, wipe it off the books and make people pass it again, or else it's gone. And they want to sunset Social Security and Medicare. Yeah, boo. And they don't give a hoot about women's rights. They're happy to do away with all women's rights. And they're all about protecting the well-heeled and the well-connected, 24 hours a day, 7 days a week. That's what they're about. This is a story about people versus politics, and we're here to talk about one particular item, and it's lowering costs for medicine and for health care. A lot of people don't know this, and they are shocked to hear it, that in the United States of America, it is illegal. It has been illegal for the last generation for Medicare to negotiate drug prices with big pharmaceutical companies. Why is it illegal? Because Medicare had no choice. The immense, powerful drug lobby worked its way with the Congress and forced that to happen about 20 years ago. And because of that, it's just because the drug companies had the power to put it into effect that Medicare was not allowed to negotiate drug prices with big pharmaceutical companies. Can you imagine anything more un-American? Not being able to bargain, not being able to negotiate, not being able to haggle. It's what we do as Americans. It's what makes us capitalists. That's an anti-capitalist, anti-American provision, and it only got in there because of the raw power of the huge pharmaceutical industry and their lobbyists. So I'm here to say, hurrah, with the Inflation Reduction Act, we started to put an end to that horrible anti-competitive feature of American law. The Inflation Reduction Act starts to allow Medicare to negotiate drug prices. You say, well, you know, what's the pushback? What's wrong with that? There is no pushback. It is a wonderful thing. It means the United States of America, through Medicare, can negotiate drug prices, use its immense purchasing power, and get reasonable rates out of drug companies. How do we know the sky isn't going to fall if that happens? Because the VA system already does that. They never did make it illegal for VA to negotiate drug prices with big pharmaceutical companies, and they've been doing it all along. So why should we allow, our seniors, they look at their annual cost of living adjustments, and they're tiny year after year after year. And I've had political opponents who are all in favor of having lower COLAs for seniors. I never understood that because they're so small to begin with. And they get eaten up by the increase in Medicare Part D premiums. That's for the drugs. That's all because Medicare was not allowed to negotiate drug prices. We put an end to that, and I couldn't be prouder of the United States Congress for doing that. We did that. It's true. It's sad. We did that with not a single Republican vote because they're okay with seniors having to foot the bill for the shareholders of the huge drug companies, and that's coming to an end. For far too long, drug companies have forced seniors to foot those bills. It's coming to an end. From 2019 to 2020, half of all drugs covered by Medicare had price increases above the rate of inflation. I remain optimistic that this historic price slashing will spill over to the private insurance sector, because what Senator Casey told you is absolutely true. Holding drug companies to not raising their prices above the rate of inflation generally is so important. The Inflation Reduction Act also limits the annual costs you pay for prescription drugs covered by Medicare Part D at $2,000 per year starting in 2025. Think about that, $2,000 per year cap. 3,000 Medicare beneficiaries in northeastern Pennsylvania, in the 8th Congressional District of northeastern Pennsylvania, had out-of-pocket drug costs that were over $2,000. That means 3,000 Medicare beneficiaries in my part of northeastern Pennsylvania will benefit from this bill. And across the state, over 70,000 seniors will benefit from the spending cap, which will be especially helpful to those who need high-priced specialty drugs for cancer, hepatitis C, multiple sclerosis, and other complex medical conditions. The new law also caps the price of insulin at $35 a month for those with Medicare, including those receiving insulin through Medicare Part B. This will benefit an estimated 7,700 Medicare beneficiaries receiving insulin right here in the 8th Congressional District. 7,700 people will benefit from that. A beneficiary who used Novolog, one of the most prescribed insulins, for example, could save $1,411 with the Inflation Reduction Act now in effect. The new law also eliminates cost sharing for adult vaccines covered under Medicare and improves access to vaccines under Medicaid and CHIP, the Children's Health Insurance Program. In Pennsylvania, as many as 250,000 seniors will benefit from the elimination of cost sharing for adult vaccines covered under Medicare Part D. And when it comes to overall affordable health care, working families will benefit by seeing lower health insurance premiums. By extending critical tax credits set to expire this year, the Inflation Reduction Act will help 17,000 people in my district in northeastern Pennsylvania currently enrolled in the Marketplace insurance. They will save an average of $1,350 in premiums starting next year. So a family in the district with 2 children and a household income of $75,000, for example, would save $2,832 on their premiums next year, and that is a big deal. That's why we call it the Inflation Reduction Act, because it's taking a big bite out of the inflation that is hitting people. Now, in addition to lowering health care costs, the Inflation Reduction Act will improve our energy security by providing tax credits and investments for energy products while creating thousands of new jobs and lowering energy costs. All of it will be funded by higher corporate taxes and savings on prescription drugs paid through Medicare. If you earn less than $400,000, you will not see a tax increase. But if you're a massive corporation that earns over $1 billion a year and you pay less than 15% in annual federal income tax, well, yes, you may see an increase. More than 50 Fortune 500 companies in this country paid no federal income tax in 2020, even though they made $40 billion in profits. The simple fact is that the Inflation Reduction Act will keep more money in the pockets of people in northeastern Pennsylvania, particularly seniors and working families. That's why I am proud to have voted for this transformational legislation, and that's why I am standing proudly with you today in support of the wonderful people on this bus tour, the Protect Our Care crowd. Thank you so very much. I'm Matt Cartwright, and I'm proud to be here. Thanks so much.
Thank you, Congressman Cartwright, for your leadership on this issue in the House and for protecting seniors and families in northeastern Pennsylvania and across the country. I'm now going to turn it over to an advocate here in Pennsylvania who's going to talk a little bit about how this bill will impact real people. Robin Stelly is with Pennsylvania Health Access Network, and she has been an amazing partner. We're so happy to have you here today.
So Representative Cartwright brought the numbers and the facts. Love those. I'm a fact-driven person. I'm going to tell you at the end of my remarks just a few very brief one-line stories of people who are going to be helped, faces behind the numbers, those incredibly powerful numbers that Representative Cartwright told us about. So thank you. Thank you, Protect Our Care, for organizing this. Thank you, Laura. So happy to see you again. Thank you, Representative Cartwright and Senator Casey, for being here and for your leadership in getting this historic transformational Inflation Reduction Act, we call it the IRA around the office, passed over the finish line. And it was not easy. over the finish line of a very long, difficult race. It's an historic law, like I said, that will transform American healthcare for the better, and that means it's going to help people, real people, as Senator Casey mentioned. So I'm Robin Stelly, an organizer with Pennsylvania Health Access Network. Each year we field over 10,000 calls from people across Pennsylvania answering the questions about health insurance and medical bills. It's our helpline. So if you know anyone who needs insurance, and believe me, you probably do. They don't talk about it though. It's not a fun topic of conversation. My kid doesn't have insurance. You want to refer them directly to our helpline. I could say the number, it's 877-570-3642, but it's Pennsylvania Health Access Network. Our navigators are the best in the state, and they will help that person find Medicaid coverage, Medicaid expansion coverage, or coverage through penny.com if any of those avenues are available to them. MAUD, CHIP, we do it all, and our navigators are the best. So please remember the Pennsylvania Health Access helpline, and for people, we help people. And because we're lucky enough to be able to hear from people, talk to people, we get to talk to them about their experience with healthcare, with insurance, with everything to do with healthcare, especially prescription drug costs. So I have a few facts. 1 in 2 Pennsylvanians have reported being worried about the high cost of prescription drugs. 20% of us have cut pills in half, skipped doses, or left their prescriptions at the pharmacy, all different ways of saying one word, rationing. They're rationing their medications without their doctor's consent or knowledge because prices are too high. That's why we at FAN are so happy that the Inflation Reduction Act is now law, and I'm going to go through the benefits again. You can't say them enough times, even though we've all said them once. I'm going to say them again. The price of insurance at penny.com will remain affordable. Medicare will finally be able to negotiate for lower prescription drug prices. Out-of-pocket drug costs for seniors will be capped. Drug corporations will not be able to raise the price of their prescription medicines faster than inflation, and starting in 3 months, I don't even want to say 2023, it's 3 months, 90 days, January, insulin is going to be capped at $35 for Medicare consumers. And vaccines are going to be free for Medicare consumers. And Laura mentioned the shingles vaccine. In my work, talking to people, I've talked to more than one senior who has not gotten the shingles vaccine because of the cost. It can cost over $200, and you need 2 of them. So I've talked to seniors who have busted their budget to get it because they know how important it is, and I've talked to seniors who have foregone it, and they won't have to now. In January, they can walk down to the pharmacy and get that shingles vaccine that they probably really need. So here are just a very few stories, 3. We have Mary, and these are all from the Scranton area. So we have Mary, who sometimes takes her heart medicine once a day instead of twice a day as prescribed. Her doctor has told her that that is a horrible thing to do, but the price of the medicine is too high. And she told me that when she plans to have an active day, she takes it as prescribed. That's not how medicine works, but that's where Mary is because of the price of this drug. So pretty soon, her out-of-pocket is going to be capped at $2,000. That's going to help her. Colleen was thrilled that the insurance she buys through penny.com will continue to be affordable for the next 3 years. That's thanks to the Inflation Reduction Act. Debbie, her monthly out-of-pocket can be up to $1,000. She is unlucky, and she has a few of those prescriptions that are $400, $300. It adds up. She's close to $1,000 in some months out-of-pocket. Thanks to this law, in 2025, her annual out-of-pocket costs will be capped at $2,000. That will be life-changing for her. So thanks again, Senator Casey and Representative Cartwright. The Inflation Reduction Act makes a real difference in the lives of people we talk to at FAN every day, so we know that it's true. And for families, for their families as well, all across the Commonwealth. We know that this wasn't easy, but you got it done, and we couldn't be more grateful. Thank you.
Thanks, Robin. Thanks for really bringing home what this bill means to the people you work with every day, and thanks for your work connecting people in Pennsylvania to the health care they need. They might not know that they need. Well, that wraps up this leg of the bus tour. I would like to thank this stop of the bus tour. I would like to thank our partners at For Our Future Pennsylvania for partnering with us here today. Thank you for all the work that you do and all the advocacy you do. Such good work around the state. And to Laura, who is with us on the tour all 5 weeks, and to Robin, and of course to our two healthcare champions who were able to join us, Senator Bob Casey and Representative Matt Cartwright. Thank you again. You can follow the tour along with the tour on all our social media channels at Protect Our Care, our Twitter and Instagram and Facebook, and see all of our events live on Facebook. So definitely check that out. And we're rolling on to Philadelphia this afternoon. So got to get going, but hopefully we can go out and see the bus. So thanks everybody.